for Karen cars, we wanted to have a way to have sick patients that were having respiratory symptoms that could be consistent with COVID-19, but very well could be some other type of virus, be evaluated. Keep them out of the ER so they don't have to go there and face the risks that are in the ER, but also keep our other healthy patients, keep them from being exposed to patients that could have COVID-19. And so to accomplish that, we figured out that we could register them as an office visit, but have them seen out in the parking lot by one of our providers who would fully assess them and in the car and see, do they need further testing or are they okay to go home? We can give prescriptions. We can give you all the instructions that you might need to take care of any type of viral illness. And so we feel like that's a really great solution to keep kids healthy, get the evaluation that they need, and keep our other patients safe as well. So we're doing a lot of video visits on our clinic, happy to provide that modality for parents. We utilize a particular electronic health record system, and so are able to do that through that system. Some require certain devices over others, and so I would look into modalities. Fortunately, CMS has realized the necessity of this and has really relaxed the HIPAA compliance restrictions. And so if you're in an individual practice, you could even consider things like Skype or FaceTime or other kinds of modalities to be able to communicate with your patients in your practice and evaluate them while they're at their house and you're in your clinic. One of the things that we considered is the consent process for video visits and Karen cars and things like that. For our registration process, when the family arrives and notifies the registration staff that they are ready to be seen, they go through the formal registration process, and the consent for care is provided verbally, and then our registration staff document that. We want to make sure that kids, get the full evaluation that they would need to make sure if they are really sick that they come to the ED if that's necessary. I have not heard of any other providers in the area that are doing this. Our community health centers have been doing evaluation for COVID in the parking lots of their clinics, but I don't know that anybody's doing this for parents and children. So we are really trying to keep as many patients and parents out of the clinic physically as possible while trying to meet their needs for evaluation. So we are keeping just well child checks for those that have not received their primary set of immunizations. This is in particular because Riverside County is in their initial surge stages, and so we feel over the next couple of weeks we need to be very careful about who comes into the clinic for their sake and for our staff and other patients' sake. So we're doing just the primary set of immunizations of 2, 4, and 6 months. If they haven't received those, they can receive them in our clinic. If they're, say, 12 months and hadn't received a full set of immunizations, they can come in at that point. But just really to get that primary set of immunizations, we are looking at relaxing that as this surging evolves. But that's what we want to do to keep our patients and families safe. For providers that maybe want to institute Karen cars for their clinic practice, there's several things to think through before embarking on that. You want to make sure that it's easy for patients to call and schedule in that type of visit, and you could either use an office visit or create a separate visit type. We opted for several reasons to create a separate visit type instead of just a regular office visit. And then you want to make sure that it's easy for the patient or the family to let you know that they've arrived and are ready to be seen. So in small practices, that's probably not too hard. They can easily call the front desk. For our practice, that's probably a little bit more challenging because we have a centralized registration system. And so just making sure that the registration staff knows the family has arrived and can communicate that to the provider and what kind of vehicle the patient and staff are in. You're probably wondering, what's the risk to my child or my patient? There was a study that came out of China about 10 days ago. Unfortunately, it looks like this is affecting children much less significantly than adults. That's good news for those of you that are parents. This is still more severe than the flu. So 94% of patients in that study that had the virus that causes COVID-19, actually did very well. They didn't require hospitalization, or we would not have hospitalized them. They were not requiring oxygen, and really just had a fever or maybe a cough, but otherwise we're doing very well. 6% of them would require hospitalization, which most of the time would require just a little bit of oxygen. And then a small percentage, less than 1%, required ICU level of care. And only 1 out of the 2,000 patients that were included in the study died, which is a very, very small number. So that's very reassuring overall for this virus. Those under 1 year were more likely to be admitted to the hospital, but none of the patients in the China study actually died that were under 1 year. So that's very good news for parents.